clearly is a very serious epidemic, but equally the fact that actually the great majority of people will not die from this. And I'll just repeat something I said right at the beginning, because I think it's worth reinforcing. Most people, a significant proportion of people will not get this virus at all, at any point in the epidemic, which is going to go on for a long period of time. Of those who do, some of them will get the virus without even knowing it. They will have the virus with no symptoms at all, asymptomatic carriage, and we know that happens. Of those who get symptoms, the great majority, probably 80%, will have a mild or moderate disease. Might be bad enough for them to have to go to bed for a few days, not bad enough for them to have to go to the doctor. An unfortunate minority will have to go as far as hospital, but the majority of those will just need oxygen and will then leave hospital. And then a minority of those will end up having to go to severe and critical care, and some of those, sadly, will die. But that's a minority. It's 1% or possibly even less.
Good afternoon. I'm sorry to have to tell you that today the number of deaths recorded from COVID in the UK has surpassed 100,000.
Out of a population of tens of millions, only 400 have actually died who are healthy between 16 and 60.
Have had confirmation that the death toll in the UK from coronavirus, according to the government's figures, has now exceeded 100,000, that very grim milestone that we had been expecting. So let me just give you the figures in the last 24 hours. Within 28 days of a positive test, that is 1,631. So that brings the total of people who've died to 100,162.
Out of a population of tens of millions, only 400 have actually died who are healthy between 16 and 60.
Today we learn that tragically 100,000 people have now lost their lives to coronavirus. That's twice as many as died in the Blitz.
Out of a population of tens of millions, only 400 have actually died who are healthy between 16 and 60.
Well, as we've heard, the COVID threat is to be raised to the highest level 5 across the UK, following a warning from all 4 chief medical officers that the health services are at risk of being overwhelmed within 3 weeks. With coronavirus cases continuing to rise rapidly, driven by the new variant of the virus, the number of COVID-19 patients in hospitals across the UK is also increasing sharply.
Out of a population of tens of millions, only 400 have actually died who are healthy between 16 and 60.
It's just horrendous, isn't it? It's absolutely horrendous. And it's the 12-month anniversary, I think, this weekend of our first recorded case in the UK. To think that in the last 12 months, 100,000 of our fellow citizens have lost their lives.
Out of a population of tens of millions, only 400 have actually died who are healthy between 16 and 60.
We've had new information shared with us today about the new variant and its seriousness. And as a result, as a Cabinet, we have decided to bring forward to tonight the restrictions that were already planned for immediately after Christmas. And over the Christmas period itself, what would have been 5 days of relaxation are being collapsed simply into 1 day, Christmas Day itself.
It clearly is a very serious epidemic, but equally the fact that actually the great majority of people will not die.
Out of a population of tens of millions, only 400 have actually died who are healthy between 16 and 60.